Homocysteine is another toxic substance the body makes. You may have heard of homocysteine. It's one of the things that we test for when we're testing for blood vessel or vascular disease. There's a number of things we test for. C-reactive protein, which is an inflammatory marker, homocysteine, fibrinogen levels, lipoprotein small a. There's a bunch of these lab tests that are part of the inflammatory condition in the vascular system. We call it vascular disease. Homocysteine is toxic enough that it's maybe at the core of Parkinson's and Alzheimer's disease. In the brain levels, homocysteine is toxic enough, the brain levels go up and there's inflammatory condition in the brain and it leads to Alzheimer's. So we don't want homocysteine. It's a toxic substance. Insulin is more toxic than homocysteine. We don't want that in our body. So we're now going to talk about, just briefly, what does standard medicine do? Because what I want to do is differentiate what we do from what they do. If I just talked about what we do, you'd agree with me all the way, because it makes sense. But I want you to see how it's different than how standard medicine is treating diabetes. Standard medicine, the diet. You lose weight by reducing total caloric intake. Their philosophy is people gain weight because they eat more than they get rid of. Isn't that the standard thing? If you would reduce the amount of calories coming in and you burn more calories than you take in, you will lose weight. That's what the philosophy is based on. And to a certain extent, that's very true. But we've already learned that diabetics, that's not true. Because as soon as you start to try to get rid of that fat, the insulin's going to stop it. So 50 to 55% of the calories should be carbohydrates. Now that means 200 to 250 grams a day of carbohydrates. What do carbohydrates break down into? Glucose. What's our problem? Glucose. So why are we pumping so much glucose into the body that we then have to treat? So we'll discover that. Low cholesterol diet. Why a low cholesterol diet? Has nothing to do with diabetes. That's because it's the prevailing philosophy. We already know cholesterol has nothing to do with heart disease, so there's no reason to be on a low cholesterol diet. There's no reason to not be eating eggs. Medications. Sulfonylureas. Now that is a category of medication. I've listed a few of them. You may recognize them if you're diabetic. It stimulates the insulin to secrete, or stimulates the pancreas to secrete insulin. Now, in diabetes, is there a lack of insulin? Is that the problem in diabetes? No. Does everybody agree? I mean, we've talked about it. If you believe what I've said, you know the problem with diabetes is too much insulin. So the treatment in standard medicine is let's give something that produces more insulin and secretes more insulin into the body. That's what a sulfonylurea is. Glucophage. Now, these are some things that we actually like. Things that improve insulin sensitivity. Glucophage, and then they have this, I always have to practice this, and I didn't practice it just before the lecture. Thiazolidinediones. Actose, there's a few things that improve insulin sensitivity, and those are the things that we can approve. They use a lot of insulin. Now, the risk with insulin is you increase the insulin level, you've added more inflammation to the body, and it may or may not drop the sugar level. But if at the early stages, when you're still sensitive to it, some people get the hypoglycemia. And this is more common in the type 1 diabetics, the children's diabetes, where they don't have enough insulin. That's when insulin needs to be used, but not in type 2 diabetes. Byetta is a new drug. I threw it in because I started to use it until people started dying with it. So the nice thing about Byetta is it releases the insulin based on the blood sugar level, whereas the sulfonylurea just stimulates the release of insulin whether the blood sugar is up or not. Slows gastric emptying, so it slows the absorption of the glucose. So Byetta had some potential good things to it. But then when it started killing people, I decided maybe it's not so good. And that's the problem with jumping on the bandwagon with all these new medications that keep coming out, because they really don't have the research. So, how do we treat it? Let's talk about how we treat it. Number one, low carbs. The problem is too much sugar. Let's drop the sugar intake and drop it down to about 60 to 100 grams. That's a half to a fourth of what standard medicine and the American Diabetic Association, the ADA diet, would permit you to have. Makes it a lot easier to control it. And that is the only way we're going to get insulin resistance to come down, is by dropping the intake and do more fiber. Why fiber? Because fiber slows down the absorption of sugar and glucose. So what I share with my patients is kind of a hierarchy of where does carbohydrates come from? Where are there more and where are there less? So, sugar, we've already talked about it. No diabetic should be taking in any sugar ever. And let me kind of rephrase that. No non-diabetic should ever take in any sugar. Ever. Nobody should be eating any sugar. We like sugar. But for a diabetic, it's got to be eliminated. Anybody with insulin resistance, it's got to be cut out. And once you make a decision to be sugar-free, that will be the best decision you made in your life. You will not believe the number of things, the aches, the pains, the tiredness, the swings, the moodiness, all of those things you've blamed on everybody else. Now you can blame it on sugar, and you have the choice to get rid of it. And you do that for a week, you will absolutely be amazed at what happens in your life.
How long does it take before you stop really craving it?
Oh, the cravings for the health. Cold turkey is the only way to do it. Well, there's a bunch of ways to do it. And we're not going to talk about it, so we'll spend a minute. Now, that is a great topic, a great question. Some people are addicted to sugar. Like any addiction, as soon as you take that first bite, you've been off of it for 3 months, and you take that first bite, what happens to the addiction? It all comes back. If you're addicted to sugar, it's like alcohol, it's like cocaine, it's like any other drug, and for the first time ever, we now have animal data showing the same neurotransmitter problems in the brain is occurring with sugar as happens with cocaine. The exact same pathophysiology in the brain is happening with sugar. So for those that have, whether they're genetically inclined or whether they've been on sugar for so long they're addicted to it, sugar is just out of the